Well, this is an ultrasound study of a 25 years female pelvic ultrasound, in which I am trying to align the uterus with the vagina, and what we see is that there is a hypoechoic solid area relating to the posterior lip of the cervix, which is the cervical fibroid that is pedunculated, which is extending posteriorly. This is the cervix, this is the vagina, and there is another mass seen. Now the cervical fibroid measures approximately 30 by 26 mm, whereas this one, this area, this is hypoechoic, and this is extending posteriorly from the posterior lip of the cervix, and this one is indenting into the wall of the urinary bladder. This is the urinary bladder, and you can see this is the indent that this solid echogenic area, which is a subserosal posterior anterior wall, posterior segment of the anterior wall fibroid. So in this section, clearly seen is that there are two fibroids. This is the area of the uterus, myometrium, and this is the fibroid. F will denote the fibroid. This is the cervical fibroid, and this is the urinary bladder, this area. And now this is the anterior myometrium, and this is the anterior lowermost segment of the anterior myometrium, where a subserosal fibroid of 30 into 25 millimeter is seen, and this is the cervical fibroid, which measures 26 into 30 mm. So let's proceed further. Now the upper segment, let's see what is the situation over there. In the upper segment, you will see another bulging from the fundus of the uterus. Let me show you the uterus first. Now this is another solid focal region. This relates to the fundal region, is pedunculated and measures approximately 67 into 33 mm. And this is another fibroid. Here we can see two in a row. This is the fundal region fibroid. This is the anterior posterior segment subserosal fibroid. This is the uterus. You see, this is the uterus. This is the uterus. Measuring approximately 5.0 by 2.5 mm, small sized, and this is the endometrial canal of the lower segment that is visualized. Only this part of the uterus is clearly seen with the central clear endometrial canal, and that too this is the lower segment. Upper segment uterus is not visualized with that clarity. Now this is the ovary. This is the right ovary with developing follicles seen within it. This is the ovary, right ovary, and you can see the developing follicles within it. Now as regarding this fibroid, you will see multiple internal cystic areas. These are represented. This is the cystic area, another So these multiple cystic areas are suggestive of internal necrosis within this fibroid, this area, this area, this area. Now these are representative of internal necrosis or degeneration within this fibroid, and the cause of the pain that she came for. This is a magnified view. Now this is in this segment I am trying to show you all the three together. Yeah. Now this is fibroid relating to the fundus of the uterus. This is the uterine segment that you can see. This is the endometrial canal. So this is the fundal region, pedunculated fibroid. This is the subserosal lower anterior wall, anterior wall, posterior segment fibroid, and this is the cervical fibroid. This is the vagina. So this was the longitudinal study in transverse section. This is the uterus. This is the uterus from here to here, and it measures 3.3 normal dimensions. Now this is the endometrial canal. It's in the proliferative phase. This is the fundal region fibroid. This one, fundal region fibroid. This is the uterus, and there is no fluid seen in this transverse section. Okay. These cystic areas are representative of internal degeneration. So the largest fibroid relates to the fundal region, is pedunculated, and has internal areas of necrosis or degeneration. And what else? Well, yes, this line, thin linear structure is the endometrial canal. So this is a case study of today that is relating to multiple uterine fibroids in this miss. See, you can see that it is in mid-cycle. The uterus is in mid-cycle. See, you can see the three layers, myometrium of the fundal region, and the posterior lower segment myometrium is seen. So this is the fibroid, fundal region, sorry, and this is the uterus. And this is the urinary bladder. This indent that you are seeing is because in the urinary bladder wall is due to this fibroid, subserosal fibroid. So this is our case of the day of a young miss with multiple fibroids engulfing the uterus at the fundal region, at the subserosal location. This is the fundal one, this is the subserosal location, this is the uterus, myometrium, anterior, fundal region myometrium, posterior myometrium, this one, and here is the cervix, and this is the fibroid seen relating to the posterior lip of the cervix. This one, this area is that of cervix. This is the vagina. So this is our case of the day. Thank you very much.